I'm Johanna Ralston, CEO of the World Heart Federation. The World Heart Federation is a membership organization of foundations and societies with a focus on low and middle income countries and reducing the burden of cardiovascular disease worldwide. We unite our members in reducing CVD and in elevating cardiovascular disease on the global agenda. The World Heart Federation was one of the founding members of the NCD Alliance. We came together with our counterparts in cancer, diabetes, and chronic respiratory disease to address not just the common risk factors that we all shared, the common risk factors of tobacco, unhealthy diet, physical inactivity, and harmful use of alcohol, but also the fact that collectively, while 63% of all deaths are due to non-communicable diseases globally, only less than 3% of global development health funding goes to NCDs. Therefore, there's a very significant gap between resources to address NCDs and the actual disease burden, and the disease burden is only increasing. The World Heart Federation felt it was very important to dedicate a significant portion of our efforts and our advocacy to coming together collectively with the broader NCD movement. One of the outcomes of our efforts has been the successful NCD summit in New York immediately prior to the General Assembly in September 2011. The focus of the September 2011 UN high-level meeting on non-communicable diseases was recognizing that non-communicable diseases, which include cardiovascular disease, cancer, diabetes, and chronic respiratory disease, really are development issues now. They've gone beyond just health. So this was not the World Health Organization, this was the United Nations convening this meeting, recognizing that NCDs, as they're called, stretch across all sectors. This was meant to bring together heads of state immediately prior to the General Assembly to address common solutions and set common goals and targets around addressing NCDs globally. The key outcomes relative to the UN high-level meeting on NCDs that are most directly related to CVDs, cardiovascular disease, were around, first of all, global leadership, addressing this as a global health issue, and then at the national level, assuring that countries have national plans which include cardiovascular disease. And then also setting targets around, for example, SALT reduction, which is one way to very directly impact CVD. Ensuring access to the Framework Convention on Tobacco Control to help curb tobacco use, which is another key risk factor for CVD. And then addressing other risk factors, including physical inactivity and poor nutrition. What the meeting means for the cardiovascular disease community is it really brought together the community in a way that was really quite wonderful. We now have become advocates. We now have become activists in a way that I don't think has ever happened before. Now we have cardiologists who frankly, were concerned about issues of around science, who are now becoming advocates in their home countries, who reached out to their heads of state, their ministers of health and their ministers of foreign affairs, and said, this is really a critical health issue. We need your attention, we need your help. So a very different mindset, and I think that one of the ways that a public health movement becomes successful is when you transform your clinicians into activists. When a clinician who is treating a disease at the very late stage or at the presentation stage starts to say, why is this happening so late? What can we do to prevent this? What can we do at a policy and population level to start to do a better job of saving lives and reducing morbidity? The UN meeting on NCDs was really only the beginning, and I think it's a long-term process, a process that really, the next 3 years are going to be critical to ensuring the success of the political declaration that was agreed to by heads of state at the meeting, ensuring that those declaration components are met, to ensure that very specific targets are set and agreed upon by everyone, and that the resources required to implement them are provided.